Hi, it's great to see you today. I'm actually in the library today. I decided to take some time out and stay in the library for a while today, getting some recharging. I know I have not been recently on this platform. However, I haven't forgotten you. I haven't forgotten my new nurses because I'm intentional in talking about excellence in nursing. Excellence in nursing in every touch. Yes, delivering high quality care to all patients with a purpose. In this high paced healthcare time, healthcare system are sometimes and can be overwhelming for the young nurse and also for the senior nurses. So one has to be intentional in ensuring that each patient receives the best care. Each patient is treated with dignity, knowing that each patient deserves the best, respect, and as you care for your patient and as you deliver high quality care, it has many dimensions. When we think of the individual, not just as a patient, but that person has all the other rights that each person deserves to survive. And so I am going to say something to you today that it starts with a change in a mindset, not in the moment. Sometimes, often, very time, we have to make decisions, and we should know that every patient deserves dignity. Each person should be treated as if that's your family member. It could be your mom, it could be your brother, whoever it is. You want the best for them. And likewise, the patient's family and the patient himself needs to be treated with respect, dignity, care, and a sense of belonging and worth and value. So, as we care for these patients, just remember the the simple, kind act or acts of mercy and care, compassion, a smile, a listening ear, eye contact. I know, I know that we might think of some cultures, yes, but I'm reminding you that in many cultures, patients want to know that you're noticing them and you are paying undivided attention. That I'm doing this and I'm over there, no, not showing interest, as it were. And patients can sense that. However, if you take that minute or two and let that patient be aware and know that you care by just listening, showing some interest, sit a moment and just listen. And of course, that can help you with your care plan. You might just be able to get some information that you were looking for. But had you not stayed with that patient for those extra minutes or seconds, you would not have achieved it. And so I'm asking you, I'm imploring you, my young nurses, take that time out and you will make a difference and you will see the difference. Keep up the good work. Excellence is critical. A touch. Yes, I know there are so many variables now. However, we can't forget the basics. You're there with a purpose, you're there with passion, and you have the potential to deliver the best high quality care to all patients. Now, thank you for listening, and I look forward to hearing from you. Now, call to action. I would like you to subscribe on my channel. I would like you to make a comment. I'd like you to share because soon and very soon I'll be delivering some very interesting topics like culturally congruent care. And those of you whom I've taught many years ago can remember how I embraced that topic because we have to value individuals on a whole, their background, where they're from, their cultures, their norms, and the list goes on. And as you do all of this, just remember self-care. Let's see a person as a whole, deserving the best and should be respected and should be cared for with dignity. Thank you so much for listening. I'll talk with you later. See you on my next episode. Bye. Dr. Miriam Smith. Thank you for listening. Bye, darling.